So, hello and welcome to the Active Learning Medicos YouTube channel. So, today we are going to have a short discussion on the very important emergency topic, status epilepticus. We are going to discuss the etiology and we are going to discuss the management. So, let's jump right into it. So, what is status epilepticus? So, it is a medical emergency condition where there is single or multiple episodes of seizure lasting for more than 30 minutes in duration and there is no regain of consciousness in between the episodes. So, etiologies of status epilepticus, we can broadly classify them into metabolic, then stroke, then systemic, infective, drug induced, then trauma, then tumor, and other rare causes. These are the various etiological reasons behind the status epilepticus. Under the first etiology of status epilepticus, we are going to study the metabolic causes. So, under the metabolic causes, we can have hypoglycemia, hyponatremia, hypocalcemia, and hypomagnesemia. Number two, stroke and tumor both under brain. So, basically, the cerebral cause of status epilepticus. So, under stroke, we can either have ischemic or hemorrhagic stroke. And under ischemic stroke, we can have arterial or venous. Then the number third cause is the systemic cause. We can find hypertensive encephalopathy. So, encephalopathy or brain damage due to hypertension. Then we can find the hepatic encephalopathy, and then we can find the renal encephalopathy. So, these three are the systemic causes of encephalopathies. So, renal encephalopathy can be due to uremia. Then, under fourth etiology, the infective. So, under infective causes, we can actually find meningitis, we can find encephalitis, and cerebral malaria. So, in number fifth cause, we see drug induced. Actually, the better term would be to say drug withdrawal, like withdrawal of anti epileptic drugs, and there can also be withdrawal of TCS. Now, rare causes can include pyridoxine deficiency, then we can see inborn error of metabolism, brain malformations, neurodegenerative diseases, and lastly, epileptic syndrome. So these are basically the other rare causes. So pyridoxine deficiency, inborn error of metabolism, brain malformation, neurodegenerative diseases, and epileptic syndromes. Now we have actually finished with the etiologies. Now let's see the management of status epilepticus, which is actually very, very important. Now, status epilepticus is an emergency condition, so the patient's stabilization and control of the seizure is the first priority. Then the investigations to rule out or find out the etiology will be done simultaneously. So, let's see the management. So, under these two broad headings, first let's come to the treatment of the patient. Because this is an emergency condition, we have to make that priority first. So, first we have to do the basic steps of resuscitation. In circulation, we have to place an IV line, because most of the medical management will be done in via the IV route needed. Then, after ensuring this ABCs of the initial management, we have to do first drug of choice is actually diazepam. These are the benzodiazepines, diazepams or lorazepam or midazolam. So these are the first line drugs we have to use, and we can repeat these drugs to control this seizure, but only 10 minutes after. We have to go on to the next step, and we have to actually manage the patient as early as possible. So after two rounds of benzodiazepines, we can try IV phenytoin. These arrows are implying that not controlled by the above drugs. So if IV phenytoin does not work, we have to try IV valproate or IV phenobarbital. If still not controlled, we have to try IV midazolam. Now, if even after all these steps the management fails to bring any treatment to the patient or control the situation, then it is probably due to phenobarbital coma. Now, here we have to actually intubate the patient and provide mechanical ventilation. So that was the rough guideline or rough management. Now, along with the management part, we have to ensure and find out the diagnosis of the cause. So first, obviously, we have to do history taking. We have to find out the following things: the onset of the seizures, the duration of the seizures, the type of the seizures, the past history of the patient, birth and developmental history, and we have to also ask the other relevant histories like history of drug use or any systemic diseases that we discussed earlier. Now, next come to the examination part. Now, in examination, we have to carry out detailed neurological and systemic examination. So these can actually give us the clues regarding any underlying neurological causes of epilepsy and under the systemic causes of epilepsy like hypertension, like hepatic encephalopathy and renal encephalopathy. So after doing the examination, we have to next do the investigation part. So under the investigation, we have to actually rule out the all the etiological causes that we discussed: the metabolic, the traumatic, the brain causes, and the systemic causes. So the following investigations are to be done: blood investigations, which include the serum electrolyte profiles and serum glucose. Then number two investigation is liver function test and renal function test to rule out those causes of encephalopathies. Then we have to do the complete blood count, the peripheral smear, plus dual antigen for malaria. Then the fifth cause is actually CSF study. So in CSF study, we can actually clearly see the meningitis picture, and we can actually pinpoint the bacterial cause or tubercular cause or viral cause of meningitis that can directly correlate with the clinical presentation of the patient. Then the other test which can be done are serum ABG. So these are the following investigations we have to carry out. So that was the basic outline of the management of the status epilepticus patient. So I hope this short discussion was very helpful, and please do share this video with your friends if you have found any value in this video, and mention down in the comments which short discussion topic you want to see next. So until then, let's end this video here, and let's meet again in the next video here.